name is Dr. Mark Olson, and I want to welcome you all to tonight's pre-care workshop. In this workshop, we're going to learn a couple of things. We're going to learn what chiropractic is, and we're going to learn what chiropractic is not. Chiropractic is not the diagnosis and treatment of conditions. But what chiropractic is getting your nervous system to function at its maximum best. Now, in this time that we're going to spend together, we're going to go over some things that you're going to probably have never seen before and other things that you may have recognized. But the whole goal of this is to get you to understand what it is that you're about to learn and about your overall health and what you're going to do in order to become as healthy as you possibly can be. So the first thing is that many times when people come in to see me as a chiropractor, I will ask them, what's the first thing that comes to your mind when you think of a chiropractor? And almost always for sure, the first answer that comes out is bones, or adjustments, or the spine. And really, when it comes to chiropractic, we have nothing to do with bones at all. We're actually nervous system doctors. Our job is to get your nervous system to function at its maximum best. There's two types of patients that generally walk in my door. Both of these types of patients will have something in common, and that normally is that they have a pain or a discomfort that they want to get rid of. But they don't also understand that there's more to just getting rid of pain than to being overall well and have wellness in your life. So when we look at this, we have to understand that the nervous system is what chiropractors are mostly involved with. And if I were to show you a picture of a nerve is actually made up into three different sections. The nervous system has what we call the motor part of the nervous system, and this is the part of your nervous system that controls your muscles. Your nervous system also has what we call the autonomic portion of it. This is the part of the nervous system that is responsible for functioning of your blood vessels, your glands, and your organs. And then down at the bottom here, we see what we call the sensory nervous system, or the third part. And that part is used for pain only. So if you can see how the nervous system is set up, 10% of the nervous system is used to perceive pain, and 90% of the nervous system is used for function. Now, unfortunately, we see majority of our chiropractors that are practicing today practice in the 10%, or the pain-bearing portion of the nervous system, and less than 1 out of 10 chiropractors basically practices in the 90%, which controls function. So you can probably see what type of a chiropractor that I am already just by this explanation. Because the mere fact that we take a look at this, you could have excruciating pain and be functioning very well. You could have no pain at all and be functioning very poorly. So when we look at this, if we have interference in the nervous system and the portion that controls the motor part, you can have such things as weakness and tightness and spasm, fatigue. Over here on the autonomic side, if we have nerve interference on that portion of the nervous system, you can have sinus and allergies, stomach and GI problems, low energy, and breathing troubles, for instance. So you can see that function is much, much more important than is just only 10% that perceives pain. Now, if we take a look at it and we understand that we're nervous system doctors, we have to understand what exactly it is that the nervous system is trying to accomplish. And the nervous system's job is one that is very easy. And it is basically to allow your system to adapt to the stresses that you put it under on a regular basis. There are 3 major stresses that your nervous system must deal with on a regular basis. And in chiropractic, we call those the 3 T's. Those 3 T's stand for traumas, toxins, and thoughts. Traumas being more to what you do to your body physically, toxins more chemically and nutritionally, and thoughts what happens with us mentally, emotionally. Now, if I were to have a slip or a fall, or you have a slip or a fall, or an accident of some sort, it could literally, physically affect your spine and nervous system. If you have a very poor diet, or if you're not getting proper nutrition into your system, it can directly affect the nervous system. And if you have overall mental emotional stress that is overwhelming the nervous system, that can affect on how well you function. So each of these does not have power over the other. They all have equal power in what they can do to the nervous system. If one or a combination of those stresses overwhelms your nervous system, this is what causes your spine to subluxate or go into a state of subluxation. Now, that does not mean that your spine is fractured or dislocated. It means that the spine and the nervous system has lost balance with one another because it's actually has been overwhelmed by one or a combination of those stresses. So if that makes sense, if you had a slip or a fall or an accident, that could subluxate your spine. If you had a bad or poor diet on a regular basis, or like I tell my patients, if you eat at McDonald's 4 days a week, that could subluxate your spine. If you have heavy mental emotional stress in your life, that can subluxate your spine. Now when that happens, we have to realize that once the spine is subluxated, there are two parts of the autonomic nervous system that dictate what does or doesn't go on. And when the spine does subluxate, it will literally activate your fight or flight or your stress response. Now in that autonomic nervous system, it can be split into two different types in the system. It can be the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is the gas pedal. This is the part of your nervous system where you have your fight or flight response, your protection survival, your adrenal gland stress response. The parasympathetic is the brake pedal. This is the part of your nervous system that slows things down. This is where we have rest, relaxation, growth, development. And this is also the part of this nervous system that controls your digestive system. Once the nervous system is overwhelmed and the spine does subluxate, it goes into a stress or a fight or flight response, which means that your teeter-totter starts to go which way? It starts to lean toward that sympathetic stress side, doesn't it? Now, if we leave your nervous system on that stress side for a long period, this can actually lead to what we call sympathetic overdrive, or what we call a chronic stress response. And the conditions that you see on the bottom of the chart here are the things that people will suffer from when they are in chronic sympathetic overdrive. Now, the chiropractor's job is not to diagnose and treat these conditions. The chiropractor's job is to remove the subluxation so that your nervous system can adapt better to the stresses that you put it on, and that will allow your teeter-totter to rebalance itself and bring the system back into a better state of wellness. So in our office, what we do is we do NASA-based technology to find out how well is your nervous system functioning and how well is your nervous system adapting to the stresses that you put it under on a regular basis. Now with that technology, we run 4 exams, and none of these exams are painful because we are not measuring your pain response, we're measuring how well you function. The first thing that we do is a range of motion study. We're going to find out to 1/10 of a degree how well the spine does or doesn't move. Because the better your spine moves, the better the nervous system can function. The second thing we're going to do is we're going to do a muscle EMG. And that's going to give us a window to look into the motor part of the nervous system. We're going to measure the electrical difference between the muscles from top to bottom along the spinal column and find out if there's any asymmetrical or distortional pulling that's allowing your spine to stay distorted and the nervous system will not have the ability to function at its best. The last thing that we're going to do as far as testing is we're going to do 2 things for the autonomic nervous system. We're going to do a thermal scan, which is going to take the temperature of the skin on each side of the spine, because the temperature of the skin at each and every level is also the same nerve that runs out to whatever blood vessel gland and organ that it is innervating. And so what happens is then we get a window into that autonomic nervous system to see how well that portion is functioning. And then the last thing we're going to do is we're going to do a pulse wave profile. And that's what we also call heart rate variability. Now, we're going to monitor your heart rate for 6 minutes. But we're not interested that your heart is beating 50, 60, 70 beats a minute. We're more interested in the time that elapses in between the beats of the heartbeat. This variability in the heartbeat is what tells us how well your nervous system is adapting to what you do to it physically, chemical, nutritionally, and mentally, emotionally. I like to refer to this portion of the exam as the lifestyle lie detector test, because it literally lets me know how well that your nervous system is adapting to the stresses that you put it under. Once we have that information, we're going to put that information all together, and it's going to give us a number between 0 and 100. If you score 90 or above on that exam, it lets me know that your nervous system is functioning excellent. If you score 80 to 90, it's functioning good. From 70 to 80, it's transitional. From 60 to 70, it's challenged, and anything under 60 is very challenged. That way we know how well your nervous system is functioning even before we start care. Now, the majority of patients who have been to a chiropractor before, they'll see a chiropractor, they walk in the office, they'll fill out some paperwork, they'll have some type of an exam done, and then sometimes they'll have the x-rays taken, and then the chiropractor puts those x-rays up on the board and proceeds to tell you how messed up your spine is. Well, the reason I have difficulties with that is because if you go on to the NASA-based technology and we find out that your nervous system is functioning at 90%, and I have an x-ray of your spine, and it shows me that there could be a scoliosis or curvature to the spine, or some other structural problem, how much do I want to change that structure if the nervous system functions at 90% with it like that? Not very much, right? So the job of a chiropractor is not to straighten your spine. The job of a chiropractor is to get your nervous system to function at its maximum best in the structure that you have. And it doesn't matter how old you are, because I have 85 to 90-year-old patients who come in who score 85 to 90 on the exam, and when I take pictures of their spine, they have all kinds of structural problems and arthritic breakdown. But that doesn't mean that they're not functioning well. I also have 10-year-old patients who come in that score 48 to 50 on the scan who have no structural deviations in their spine. Okay? So it doesn't matter how old you are. Our nervous system is the same from when we're young to when we're old, and it needs to understand how well can it function with the structure that we have and what type of stresses that we put it under. So as you become a patient in our office, it's going to be vital that we have that information before we get you started. And once we have that information, then we can make a better decision what's the best route to go for you to get your health back to where it needs to be based on how well you do or how well you don't function. And I always let people know that as far as becoming a new patient in our office, it's not a right to be a patient here. It is a privilege to be a patient in our office. If the patient is not willing to participate in their overall care, there's no way that we can just make adjustments only and clear the nervous system out if they're going right back out to do all those things that cause the spine to subluxate and their health to diminish in the first place. So we welcome each and every one of you to the clinic. And once again, we thank those people who referred you here so you could hear this pre-care orientation. So 90% of my patients have an excellent result if they follow through the plans that we set for them. And they love the results they get. And I know that you will too. So we look forward to getting your guys' scans, and we look forward to doing your consult so we can see what is the best road to take for your overall health.